Right then, welcome to this deep dive where we'll be taking a good look at rare diseases. They're not something we talk about every day, are they? But they do affect millions around the world. And today, we're really going to get to grips with just how big of an impact they actually have.
That's right. And we're going to sort of try and steer clear of that kind of, medical textbook approach to it and think of this more as a chat, a conversation between two doctors, really, just wanting to share some insights on rare diseases.
Yeah, exactly. And hopefully give you a bit of a feel for what it's actually like for the people living with these conditions. So first things first, what exactly makes a disease rare?
Well, you'd think it'd be fairly simple, wouldn't you? But actually, it's a little bit more complicated than that. But generally speaking, it's when a disease affects a small percentage of the population, so often less than 1 in 2,000 people.
So then a disease could be rare in one country, but not in another.
You've hit the nail on the head there. It all depends on where you are in the world. But there's something that really struck me when I was, sort of preparing for this, and that is that while each rare disease might only affect a small number of people, collectively they actually have a massive impact. We're talking about 6 to 8% of the global population. That's a lot of people, isn't it?
It really is. Now, I think it's worth noting that most rare diseases, they're actually chronic, aren't they? I mean, what does that actually mean for those affected?
You're absolutely right. Yeah, and chronic means these conditions require ongoing care quite often, throughout a person's entire life. And you can imagine what a challenge that can be, not only for the person with the disease, but also their families. The constant hospital visits, the treatments, the emotional burden, it's a lot.
It really is. It's almost heartbreaking to think about. And to diagnose a rare disease, that must a bit like detective work, really. These conditions are uncommon, so they could easily be mistaken for something else.
That's exactly right. Yeah. You've got to consider all angles, really. And it often involves a whole team of specialists, from GPs to geneticists, all working together. And they'll look at, the person's symptoms, their family history, and they'll do, a whole battery of tests, often including genetic testing, just to try and really pinpoint what the problem is.
All right. Now, to help illustrate all of this, should we perhaps delve into a few specific rare diseases? Should we start with Huntington's disease? I
Yeah.
always find this one particularly interesting because it's caused by just a single faulty gene.
Yes, it is. Huntington's is a neurodegenerative disorder, really quite a devastating one. And as you said, that one faulty gene ends up causing, all sorts of damage to brain cells. It leads to problems with movement, with thinking, even with behavior.
So essentially, it robs a person of control over their body and their mind. It's terrifying.
It really is, yeah. And what's remarkable is that it's just that single gene mutation that can lead to such widespread damage. Basically, that gene, that mutated gene, produces this harmful protein which slowly builds up in the brain, and that disrupts its normal function, causing the brain cells to die off.
Right, right. And this faulty gene, it follows a pattern called autosomal dominant inheritance, doesn't it? Could you maybe explain what that means for someone who might inherit it?
Sure. So imagine this. If one of your parents has this faulty gene, you have a 50-50 chance of inheriting it. And because it's what we call dominant, even inheriting just one copy, you are guaranteed to develop the disease at some point in your life. And that's a really difficult reality for families who are facing this condition.
It is, yeah. So moving on then, should we talk a little bit about cystic fibrosis? Cystic fibrosis, or CF, as it's commonly known. Now, this one is quite close to my heart because I've actually known a few people who live with it. And it mainly affects the lungs and the digestive system, right?
Yeah, that's exactly right. And at its core, CF is caused by, again, a faulty gene. But this time it's a gene that disrupts the flow of chloride ions in cells. And this then leads to the production of this thick, sticky mucus, which then clogs up the airways, making it really difficult to breathe. But it also blocks the digestive tract, so it affects how your body absorbs nutrients.
Wow. So it's causing these blockages in two really vital systems in the body. What can be done to help manage these symptoms?
So sadly, there's no cure for CF just yet, but there are lots of different treatments that can make a huge difference to a person's quality of life. Things like, chest physiotherapy to clear the airways, antibiotics for lung infections, and enzyme supplements to help with the digestion.
Right. And that's encouraging to hear. So for something a bit different, maybe we should touch on Marfan syndrome. Now, what I find fascinating about this one is how it affects the connective tissue. And connective tissue is basically everywhere in the body, isn't it?
It is, yeah. Marfan syndrome is definitely quite a unique condition, and it's all because of a mutation in a gene called FBN1. And this gene is really crucial for producing a protein called fibrillin-1. Now, this protein is absolutely vital for maintaining the strength and elasticity of our connective tissue. And like you said, connective tissue, that's all over our bodies.
So what happens when this protein isn't functioning properly? Does that mean the body's kind of scaffolding, is weakened?
Yeah, precisely. And that can lead to various physical characteristics. People with Marfan syndrome are often quite tall, have long limbs, flexible joints. But much more importantly, it can cause some really serious problems with the heart and blood vessels, particularly the aorta, which is the main artery carrying blood away from the heart.
That does sound serious. Right. Now for our final spotlight, how about we discuss Gaucher disease? Now, this one rings a bell, isn't it? It's a metabolic disorder.
It is, yes. Gaucher disease is caused by a deficiency in an enzyme called glucocerebrosidase. And this enzyme, it's responsible for breaking down a particular fatty substance called glucocerebroside.
And without this enzyme, without enough of this enzyme, what happens?
Well, imagine your body as a sort of a well-oiled machine. When a vital component goes missing, things start to go wrong, don't they? So in this case, that fatty substance, that glucocerebroside, it starts to build up in various organs, particularly the liver, spleen, the bones, the bone marrow. And this can lead to all sorts of problems like enlarged organs, bone pain, and even blood disorders.
I see. And this enzyme deficiency, this is genetic, right?
Yeah, Gaucher disease is what we call a recessive genetic disorder. That means both parents have to carry the mutated gene for their child to actually inherit the condition. So it's like an unfortunate roll of the genetic dice, if you like.
Right. Welcome back to our deep dive into rare diseases. And this time, we're going to shift our focus a little bit from the science to the human element, really.
Yeah, because behind all these medical terms and all the explanations, we must remember that there are real people, real families who are dealing with living with a rare disease every single day.
Absolutely. And that reality, it can be incredibly tough, both emotionally and practically. Just imagine being told that you have this condition that you probably never even heard of, and there's, no clear treatment plan, and your future is just full of uncertainty.
It must be completely overwhelming, not only for the person themselves who's been diagnosed, but, for their loved ones as well. Absolutely. It's a huge emotional toll, isn't it? First, there's the shock, the disbelief, and then all these emotions just hit you, fear, sadness, anger, and you can feel incredibly isolated, like you're fighting this battle, all on your own.
And that's where support networks and reliable information, that's where that all comes in. Having people who understand what you're going through, that must make a world of difference.
It really does. Just connecting with others who get it, it can be an absolute lifeline. And things like, patient support groups, whether that's online or in person, they're just brilliant for this. They offer emotional support, practical advice, and just that sense of community that's so important.
That sense of, not being alone on this journey. Aside from the emotional challenges, I imagine there are practical hurdles as well. Managing a chronic condition, it's not straightforward.
No, absolutely not. Think about it. The constant hospital appointments, the specialist treatments, maybe having to deal with complex medical equipment at home. It just puts a strain on your time, your finances, your whole life, really.
I imagine even just, simple things like going out to the shops, that could become a real logistical problem.
It really can, yeah. And then there's the issue of access to care. A lot of people with rare diseases, they need to see specialists who, might not be available locally. So that might mean traveling long distances for appointments, which just adds another layer of stress and difficulty to the whole thing.
It's almost like facing hurdle after hurdle.
Yeah.
And that's why advocating for better access to care, that's so important, because everyone deserves the specialist care they need, no matter where they live or what their financial situation is.
I couldn't agree more. And that's where, these patient organizations and advocacy groups, that's where they really come in. They do incredible work in terms of raising awareness, supporting research, and just pushing for policies that really improve the lives of those affected.
Yeah, they're not just offering support, they're actually driving real change, which is inspiring.
It really is. They're the voice of the rare disease community, aren't they? Making sure that that those who are often overlooked are heard, and their work benefits not just individuals, living with rare diseases now, but also future generations.
Yeah, because by investing in research and by pushing for innovation, we can potentially develop new treatments and maybe even cures,
Yeah.
offering hope to those who might be diagnosed in the future. And speaking of research, there have been some really exciting developments, haven't there, just recently?
There have, yeah. Research is really the cornerstone of progress when it comes to rare diseases. And we're seeing groundbreaking developments, particularly in areas like gene therapy and precision medicine.
Can you expand on that a little bit, because they both sound incredibly promising?
They really are, yeah. So gene therapy, we touched on this a little bit earlier, but this basically has the potential to really tackle the root cause of genetic diseases, doesn't it? And we're actually seeing some remarkable results in clinical trials for things like, spinal muscular atrophy, hemophilia, and even some cancers.
It's incredible, isn't it, to think that we're almost on the verge of being able to cure diseases that were once considered incurable.
I know, it's amazing, isn't it? And then you've got precision medicine, which is all about tailoring treatments to each individual's unique genetic makeup and the specific characteristics of their disease.
So moving away from that sort of one-size-fits-all approach to treatment.
Exactly, yeah.
Yeah.
So by really understanding the specific genetic drivers of a particular disease, we can then develop much more targeted therapies, which are much more likely to be effective and probably have, fewer side effects as well. It's a real game changer.
Yeah. It sounds like we're entering this whole new era of medicine where treatments can really be personalized.
We really are. And while there's, still a long way to go, the progress that we're seeing at the moment gives us real cause for optimism. But even with all these advancements, early diagnosis is still absolutely key, wouldn't you say?
Oh, absolutely. The sooner we can identify the problem, the sooner we can, put the right treatment in place and hopefully slow down the progression of the disease. But I imagine there are challenges with early diagnosis, particularly when it comes to rare diseases.
Yeah, there are. One of the biggest hurdles is that a lot of rare diseases, they present with very general symptoms, that could easily be mistaken for more common illnesses. And this can lead to delays in diagnosis because healthcare providers, they might not initially think, oh, well, this could be a rare disease.
So it's not just about, raising awareness among the public. It's also about raising awareness, within the medical community.
Absolutely. We need to make sure that doctors and nurses, they're equipped with the knowledge and the tools to spot those potential signs of rare diseases and to refer patients for specialist testing when it's needed, because that early intervention, it can make all the difference.
Yeah, I know we've covered a lot of ground in this section, but I'd like to leave our listeners with a sense of hope and empowerment. So what would you say to someone who's just been diagnosed with a rare disease?
Well, I'd say first and foremost, you're not alone. There are so many researchers, healthcare professionals, and advocates out there who are working so hard to improve the lives of people living with rare diseases. And with continued research and innovation, we are getting closer and closer to a future where these conditions are manageable and hopefully one day curable.
Welcome back to the final part of our deep dive into the world of rare diseases. Now we've covered the science, we've talked about the challenges, the breakthroughs, but now I think it's time to ask the question, what can we actually do, as individuals and as a society to make a real difference for those living with these conditions?
Yeah, that's a really good question, and I think it's the point where we move from talking to action. We can talk all day about the science and the research and the advancements, but without action, without actually putting things into practice, it's all just words, isn't it?
Absolutely, yeah. So where do we even begin with that? It can feel a bit overwhelming, especially when we're talking about something as complex as rare diseases.
Well, I think for me, it starts with just acknowledging the huge impact that these conditions have. That they might be rare individually, but as we've discussed, they affect millions of people across the globe, and that's a huge number of people, and we can't just ignore that.
No, absolutely. It's about raising awareness, isn't it? Yeah. Making sure that rare diseases aren't just seen as someone else's problem, but as part of our shared human experience, I suppose.
Yeah, absolutely. And with awareness comes understanding, doesn't it? And that can really help to break down the misconceptions and the stereotypes that sadly still exist around rare diseases.
Yeah, because knowledge is power, isn't it? The more we understand about these conditions, the better equipped we are to support those who are affected. But what does that support actually look like in a practical sense?
Well, it can take many forms, really. It could be as simple as just listening to someone share their story, offering a helping hand, or maybe volunteering your time at a local patient organization.
Yeah.
Even small gestures like that can make a world of difference.
Absolutely. It's about showing compassion and solidarity. But what about on a larger scale? What can we do to encourage more research and to speed up the development of new treatments?
Well, that's where things get really exciting. We're already seeing these breakthroughs in gene therapy and precision medicine, but to really kind of unleash their full potential, we need continued investment in
Mm.
research. It's as simple and as complicated as that.
Yeah. So funding is obviously crucial, but I imagine it's not just about, throwing money at the problem. What else needs to happen to make sure those research efforts are actually effective?
Well, collaboration is absolutely key. We need to break down those silos between researchers and clinicians and patient advocacy groups. Sharing information, sharing data, sharing expertise, that's absolutely vital if we want to really speed up the pace of discovery.
So it's about working together, isn't it?
Yeah.
Towards a shared goal, pooling our resources, pooling our knowledge. But traditional clinical trials, they can be a bit tricky with rare diseases, can't they? Because by their very nature, the patient populations are so small.
They are, yeah, and that's why we need to be a bit more creative in how we design those trials. The old ways of doing things, they often just don't work. Thankfully, there are new approaches being explored, like decentralized trials, which allow patients to take part in trials, from the comfort of their own homes, cutting down on travel and intentionally giving more people access to these cutting edge therapies.
So it's about making research more patient-centric, isn't it?
Right.
Recognizing that people with rare diseases, they're not just data points, they're active participants in their own care.
Yeah.
And their voices need to be heard.
Yeah, 100%. Patient engagement in research is absolutely crucial, whether it's, helping to design studies or sharing their lived experiences. Their insights are just invaluable. It's about giving them a sense of ownership over their health journey and empowering them.
So as we wrap up this deep dive, what would you say is the key takeaway you want our listeners to leave with?
Well, for me, it's that rare diseases, yes, they're complex, they're challenging, but they don't have to define a person's life. There's so much hope out there, there's so much progress being made, and there's a whole community of people who are fighting for a better future.
Absolutely. And that fight is something that we can all be a part of, whether it's through raising awareness, supporting research, or just simply showing kindness and understanding to those who are affected. Even the smallest actions can make a real difference.
Yeah, I think that's a perfect note to end on. Thank you so much for joining us on this deep dive. We hope you found it informative and insightful and maybe even a little bit inspiring.